Assalamu alaikum. Good evening and welcome to all of you, my audience, to Health Hour by Caregiver Alliance. My name is Dr. Sharmeen Zaruk, and I'm a family physician at Indus Hospital, Manawa, Lahore. I'm here, I've been invited by this organization to speak to you about a very important issue today. That is the common cardiac issues that take place. I will be discussing those also alongside identification of the danger signs, uh, meaning which symptoms do we look for when deciding when that a patient needs to be sent to the emergency department. Lastly, I will be discussing what changes are required in our lifestyle that we need to prevent these conditions from happening, or even if we cannot prevent, to reduce our risk of these conditions from happening. All right. So I know we have a very diverse group here in this audience today, and all of you may not be in the healthcare profession. Therefore, I will try to keep this as simple as possible. And at the end, I will be doing a verbal presentation, and at the end of this session, we can have a question and answer session also. This session is basically important for all age groups, all right? It's not just for the elderly. A lot of people think cardiac issues means just for the elderly age group. This is for all age groups, even the younger age group, because you may have heard of cases where cardiac issues are taking place in the younger age group. Reason being multiple risk factors, for example, a strong family history, uh, bad dietary habits, sedentary lifestyle, being overweight. So all of these factors, smoking is a very big, huge risk factor. So all of these factors contribute to developing these conditions. All right. So I will start off by talking about hypertension and then moving on to chest pain, which will encompass angina and heart attack. All right. So let's start off with hypertension. Everyone hears this terminology. What is hypertension? It is when a patient is diagnosed with high blood pressure. All right. So a lot of you will have family members who may have high blood pressure. All right. So first we need to know what is the normal reading of a person without hypertension. What is a normal blood pressure reading? So a normal blood pressure reading should be 120/80 or less than 120/80. All right. But for a patient who is already a known hypertensive patient, who is already on hypertensive medication, his values, his readings should try and remain below 140/90. Okay, I'm telling you these readings why, so that you're aware. If you have certain family members who are having this condition, then you should know what should be the goals of keeping their blood pressure. Simultaneously, if there's a hypertensive patient and he has diabetes alongside, so you should try and aim that his blood pressure reading should be less than 140/80. All right. But if a hypertensive patient has any kidney conditions alongside, then his blood pressure readings should be at least below 130/80. All right. So now we know what is hypertension, what are the normal readings or not. How do we know that a person with hypertension needs emergency care? What are the signs? A person can have a blood pressure reading of 150/90, 160/90, 170/100. Does it mean that that patient needs emergency care? No, not necessarily. The criteria, the danger signs are if a patient has a blood pressure reading and he may be hypertensive from before, or he may not be hypertensive from before, because a lot of people who come to us, they don't know for years that they're suffering from hypertension. They're just going on and about their lives. It is an incidental finding when they come to the OPDs or the clinics. It is then they find out that they're suffering from hypertension. So, if a patient, a family member, or anyone has a high blood pressure reading of greater than or equal to 180, the above reading I'm talking about. If he has greater than or equal to 180, and the below reading is greater than or equal to 110, that is a reading where the patient needs to be taken to the emergency. He may not have any signs or symptoms right now, as in he may not have any complaints right now, but still he needs to be taken to the emergency department. Why? Why? Because a high blood pressure can lead to further complications, which are heart attacks, strokes, kidney failure, damage to your eyes. Therefore, it is of paramount importance that if any patient, any family member, any friend has a condition or has a blood pressure reading this high, he needs to be referred to the emergency department for immediate management. Okay. Now, if a patient has this high reading, as I mentioned, the above reading is greater than or equal to 180 and the low reading is greater than or equal to 110. But he may have certain symptoms also alongside, certain complaints, which could be, and these are the danger signs that we need to be aware of, which could be a severe headache, blurring of vision, chest pain, breathing problems, ankle swelling, pain in the leg, uh, blood in his urine. So if he has complaints, he or she has complaints or so these complaints, then also the patient needs to be referred to the emergency department immediately. This is known as a situation known as hypertensive emergency, where a patient needs to be referred to the emergency department. If the patient does not have these symptoms but just has high blood pressure, as I've mentioned previously, then the patient that is known as a hypertensive urgency. All right. So in both conditions, the patient needs to be referred to the emergency department. This is very important because we want to prevent the patient from having further complications. Now, uh, there are two conditions which you need to keep in mind. There are patients who are taking the hypertensive medications who are known hypertensive, but their blood pressure is still not under control. As in, their blood pressure reading is around 150/90, 160/100. This is also important for you to realize if you have any family member, sibling, friend who has this readings of blood pressure while taking hypertensive medicine, kindly guide him or her to consult his physician so that his medication dosage can either be adjusted or medication can be changed because it basically means the medication is not working right now. So it needs to be changed or dose adjusted. Right. So this is one issue that you need to be aware of. Two is a lot of people patients do come to us and they say that I had hypertension. I took a medication for 2 weeks, 3 weeks, and now my reading is normal. So therefore, I have stopped without consulting my physician. Again, my emphasis is please tell these people, your family members or friends, do not stop taking any hypertensive medications without consulting your physician. Because you see, hypertension, like high blood pressure, is like high blood sugar, diabetes mellitus. It is a lifelong condition. It is not going to go away if you take medication for 5 days or 7 days. It is not flu. It is not cough. It is not a simple routine infection. It's not going to go away like that after 5 day medication. It needs medication for lifelong. The medication can be less, more, doses can be adjusted, but still he will need to take his medication because if he does not, it can lead to the complications that I have mentioned above, which are important. This does not mean to scare people off, but they need to know that they're having a certain condition and what can be complications. For example, a heart attack. For example, a stroke, kidney damage, damage to the eyes, like I mentioned. So they need to be aware of this. Correct. So now I've spoken to you about what is hypertension, how do we identify the danger signs, as in when the patient needs to go to the emergency. And again, I will reinforce a patient does not need to have symptoms all the time. A lot of people say, I had a headache for a whole day. So I thought maybe I have high blood pressure because my brother has high blood pressure. So I took his blood pressure medication. No, it does not work like that. Headache is not related to high blood pressure. Yes, patients with hypertension may experience symptoms of headache, but if you have a headache, it does not necessarily mean that you have high blood pressure. And high blood pressure can sometimes be just an incidental finding. Again, I'm reinforcing. So if you have a strong family history of high blood pressure or heart cardiac issues, then kindly keep a check on your blood pressure. Now, what can we do to prevent or to reduce our risk of developing high blood pressure or developing the complications of high blood pressure? These are called the non-drug measures. which are very, very important. This importance first and foremost is education, education of the patient, your family member, your friend, like what I'm telling you. So even if like I said, patients who do not take the medications regularly, or they said we've taken it 1 day or 2 days, and then we stopped, and then we take it irregularly when our blood pressure is high. A lot of patients come to our clinics and they say that कि जी हमारा ब्लड प्रेशर कल परसों मैंने दवाई खाई, आज मेरा ब्लड प्रेशर ठीक था तो मैंने दवाई नहीं खाई. But that's not how it's supposed to be. Obviously, your blood pressure is normal now because you have taken the medication a day earlier, but you need to take it regularly. Otherwise, it is going to become high, obviously. So, education of the patient that you are suffering from this condition, taking regular medications are very important. And secondly, if you do not take your medications, what can be the complications? The point is not that you're going to scare your relatives or friends off, but you have to make them aware of this condition. So I feel as we don't need to be health professionals, doctors, nurses, or paramedics to create this awareness. You, as members of this audience, as members of the society, have a responsibility of their own, have a responsibility to create this awareness within your households, within your community. Like nowadays, we all have a responsibility. There's a COVID-19 crisis going on. So we all, as individuals, as citizens of Pakistan, have a responsibility to wear a mask and keep a safe distance. All right. So again, so this is a responsibility. So one is education, right? Two is your dietary lifestyle changes. What is that? Reducing your salt intake, very important for a patient with high blood pressure. Kindly make sure it's not easy that you tell a person with high blood pressure कि जी बस नमक खाने में डालना बंद कर दें. It's not easy like that. If someone were to tell me कि जी नमक ना डालें अपने खाने में, it's not possible. I've been having salt all my life in my food, and I'm not going to enjoy it, my food, if I have no salt in it. So we start off gradual. We tell them, reduce the amount. If you take a full teaspoon, bring it down to half. Then eventually bring it down to a quarter. And then if you feel you can completely stop it, that would be best. Or that would be great. Okay. So reduce intake of salt. Reduce the intake of oily, fatty, and fried foods. Very, very important. Okay. So reduce the intake of this oily, fatty, and fried foods. Reduce your intake of alcohol and caffeine. Okay, so three important items that you need to reduce. There's a very if you search on Google, you will find a DASH diet. A DASH diet is basically an abbreviation for dietary approaches to stop hypertension. Dietary approaches to stop hypertension. So when you open up, Google Chrome and look up DASH diet, it's going to show you a plate, and this plate is going to have portions of certain food and how much you could have per day. So this is going to have your lean meat, which is fish and proteins. This is going to have your limited intake of fats and oils. This is going to have your legumes and nuts and grains. This is going to have portions of fruits and vegetables. And this will tell you how many portions you need to take per day. So I would suggest people who are suffering from this condition, from hypertension, please look up this diet, DASH diet, on the internet. And also, if you have a nutritionist or a physician, do consult with him or her, because it's very important to know how much you should take of what. So we talked about education, we talked about dietary changes to our lifestyle. Very important is stop smoking. Smoking is a huge risk factor. It is a huge risk factor for hypertension, for heart conditions, for heart attacks. So kindly stop smoking. If anyone drinks alcohol, please reduce the intake of alcohol. This is also another risk factor for developing the complications of hypertension. Exercise is very important for any hypertensive patient, diabetic patient, and even for regular people. Keeping a healthy, fit lifestyle is important. So exercise is important. But how much exercise to do? People don't normally do that. So as family physicians, we guide our patients. You should be doing a brisk walk of 30 minutes per day for 5 days a week. So a walk of 30 minutes per day for 5 days a week. And this walk should be a brisk walk, meaning you should start sweating. So exercise is important. Then comes down to people who are overweight or who are obese. So being overweight or obese is also a risk factor for heart conditions. So kindly try to reduce your weight by dietary changes and by exercise. Also, a lot of people have comorbidities, meaning they have diabetes mellitus alongside hypertension. So diabetes is, a risk factor for cardiovascular disease, for cardiac issues, even if it is controlled. But it is best that you do not keep it, you keep it under control, as in you do not let it go here and there, your sugar levels. You should try and keep it under control because diabetes is also a factor if you have comorbidities alongside hypertension. It is a risk factor for developing heart conditions. All right. Lastly, I will talk about stress. Stress is also very important. Maintaining stress, where everyone suffers from stress in all age groups. It can be your stress related to home, stress related to work, financial stresses, and nowadays all of us in all age groups are in stress because of COVID-19. We don't know how long this is going to go on. We don't know, if this is going to end. What about our lives, our children? We all tend to worry about that. So it is extremely important to regulate your stress levels. And how can you do that? Exercise is one way of doing it. Any sort of activity. YouTube has everything nowadays. They have everything online resources of, exercises, aerobics, yoga, meditation, and if not that, if there's anything that you like to do, as in gardening, stitching, cooking, Quran classes, dance classes, singing classes, anything that you like to distract yourself, regulate your stress levels. And if none of this works, then speak to a family member, and or lastly, contact a psychologist or a counselor to regulate your stress levels. So these were the important non-drug methods that we need to take up to improve our lifestyle so that we do not develop hypertension or the complications, right? Education, diet, smoking, alcohol, exercise, stress levels control, and obviously the other comorbidities. Also remember that patients come and they say that we have a family history of hypertension. So can we prevent this from happening? Again, I will say that you may not be able to prevent it, but you may be able to delay it by controlling all these factors that I've mentioned up above, right? So I've spoken a lot about hypertension. If I go fast at any time, or if any of you are unable to understand, please put it up on the chat box, and I will rephrase or repeat what I have said and slow down also. All right. Okay. So moving on to chest pain, where we're talking about angina here. A lot of people use this word frequently, but what is angina? Okay, so angina is basically a pain which occurs when there's narrowing of your blood vessels, narrowing of the blood vessels which are leading to the heart. Okay, this occurs mostly due to exertion, right? So your blood vessels, if this is their width, then they become narrow, and this is usually due to fat deposition. Excuse me. So, if the blood vessels are narrowed, uh, the heart muscles are not able to get enough blood. And blood, as we know, carries oxygen and nutrients, okay, which is very important for the heart. So, chest pain occurs especially on exertion because on exertion, heart muscle requires more blood to keep up with the increased workload. Okay, therefore, this angina pain occurs on exertion only because you know, uh, for example, a car, when you're slow, it's going to be, it will not need enough, lots of fuel, right? But when you're accelerating and driving fast, your car is going to require more fuel. So that's how the heart works. If you're going to exert yourself, maybe doing some exercise, going up and down the hill, is going to need more blood. But since the vessels are narrowed, this is going to cause a problem, and therefore you develop this angina, which is known as chest pain. Okay, but how do we know that this is angina pain and not any other sort of pain. For example, a muscular spasm or a stomach pain. Commonly, people call it as mede ka dard. All right. So, if we talk about muscle pain, because this angina pain, I should tell you, is mostly at the center of the chest, center or left side of the chest. All right. So, it can be confused with muscle pain or stomach pain. How do we differentiate? If there's a muscle pain, a patient will be able to pinpoint the exact location of the pain, site of the pain. With angina pain, it is more diffuse, the pain. All right. And a patient will have a strong history of doing some sort of activity, vigorous activity, exercise, or some heavy lifting, after which he says that he developed this sort of pain in his chest, and this pain will also resolve after taking a painkiller. So that goes more towards a muscular spasm, right? And how do we differentiate it from a stomach pain? Because that also occurs in the central area, right? So a stomach pain is mostly going to occur when a patient has had really heavy, spicy, oily, fatty meal. So he or she is going to say, I just had this meal, and after that, I'm feeling this heaviness or this pain here. So that gives a strong indication towards that. And this pain is going to be relieved by taking an antacid. All right. But do keep it in mind. We have patients who, for example, have a history of high blood pressure uncontrolled, who also have diabetes mellitus, and they complain of this pain here in the stomach area. You need to be safe. You cannot take a risk because the symptoms of a heart pain and the stomach pain are similar. So if a patient has a strong history of heart or diabetes, or he or she is of an elderly age group, you need to be safe and still take the patient to the emergency department for an ECG, because a lot of times we have seen patients who just come to us with the complaint of this heaviness, but because they have this history of hypertension or maybe heart condition or diabetes mellitus, we always go for an ECG, and usually we do find findings on it. Therefore, please be safe with your family members. All right. So, how do we know how do we know this pain is of angina? As in, what are the danger signs? How do we explain this pain? So this pain, as I mentioned, occurs in the central area of the chest, near the stomach or the area, or on the left side. All right. This pain is sort of crushing and heavy sort of pain. A patient is going to describe it like that. He's going to say it's heaviness on my chest. This pain will radiate towards the left arm, under your jaw, your throat, or your teeth. Okay, and the patient may also complain of symptoms such as nausea, vomiting, shortness of breath, uh, feeling of increased heart rate, and sweating. So commonly, patients may have, but they may not have these symptoms all the time. All right. This pain, as I mentioned, occurs at time of exertion. It lasts less than 15 minutes, but it is relieved by taking rest, or if a patient has already had similar complaints of angina before, then he may have been prescribed an anti-anginal medication. So in this case, if it's angina pain, this medication is going to relieve the pain as well as rest. Panadol, a painkiller, is not going to relieve the pain. So now we know that these are the danger signs. If a patient is complaining of such sort of a pain, he needs to be taken to the ER immediately. But again, I will reinforce, do not wait for all of these signs and symptoms. A patient sometimes may not have this pain at all. For example, a diabetic patient. A diabetic patient will not feel the pain, the chest pain that we commonly say occurs in a heart attack or an angina pain. He may not feel any pain at all. So if he just has even similar complaints, like some complaints which may be slight, for example, he feels short of breath, he or she feels short of breath, or feels sweaty, or feels nausea, or any one of these, or maybe two or three together, please be careful and take the patient to the emergency department or call an ambulance, because you do not want to take a risk with any family member or any friend. All right. As I mentioned, there are patients with angina who have been prescribed anti-angina medication. So if anyone is suffering from this pain, please take those anti-angina medications at that time. But still, you have to go to the emergency department. You still have to go to the emergency department. Okay. Now that we have identified, we know what is angina pain. We have identified what are the danger signs. When do we know this is angina pain? What can we do to prevent it, or try and reduce the risk of having angina? These are the non-drug measures. These are similar to the hypertensive non-drug measures. And what are they? Education. Please, it's very, very important. Educate your family members. Educate those people. The elderly, I know a lot of elderly age groups. They say that we're too old for this medication now. I cannot take so many medications. And why bother? No, you have to convince them that they have to bother. They have to take these medications so as to stop further complications because they do not simply understand what can happen, what is the worst that can happen. So, education again, the dietary modifications, salt, fatty, oily foods, alcohol, reducing your alcohol intake, stop smoking, please. Very, very important. People who do smoke, please stop smoking. And I know patients do come who have had angina attacks, and they still continue to smoke. Excuse me. So please remember that's a huge risk factor for further complications of the heart. So smoking, alcohol, dietary advice, education, your exercise regime, to control your weight, control your blood pressure if you have blood pressure, and if you're diabetic, control your sugar level. And again, I'm going to tell you because again, this is very important to remember. Diabetic patients will not feel the pain. They may just complain of. They will say, "हमें घबराहट हो रही है." They will just say कि जी हमें घबराहट हो रही है, and that's it. They only come with that complaint. As I mentioned previously, some say कि जी हमें सिर्फ heaviness है अपने central area में chest के, but others will just say घबराहट. So if a diabetic patient with a history of hypertension is coming with this complaint, please refer him or her to the emergency department and do get an ECG done, please. Lastly, people who drive and who have had these complaints of chest pain, they need to remember that they have to stop driving till the symptoms are resolved, till they're seen by a cardiologist, till their workup is done, till their medications are started and the symptoms are resolved. Because why? Because while driving, if you develop chest pain, so that is harmful not just to you but to the people around you on the road. So please be safe. Please be safe in that way. Okay, so this was about angina. What is angina? What are the symptoms that are caused by anginal pain? And how can we, prevent this or reduce the risk factors by changing our lifestyle, the non-drug measures. All right. So let's move on to a chest pain, which occurs in a heart attack. So heart attack is also medically known as a myocardial infarction. Okay. What is a heart attack? Um, a heart attack occurs when an artery of the heart is severely narrowed or completely blocked. So, when a vessel is narrowed or completely blocked, obviously the oxygen-rich blood is not able to reach the heart. Therefore, a portion of the heart which that blocked artery is supplying to is affected. And if that blocked artery is not opened immediately, that portion of the heart may die. This is the difference between angina and heart attack. In angina, the portion or the muscle of the heart does not die because the vessel, the artery is not completely narrow. There is still a bit of path for the blood to pass through. But in a heart attack, it is extremely narrow, the vessel very narrow or completely blocked. So obviously, blood is not going to go to that part of the heart, and that part of the heart is going to die. This usually occurs. The blockage of the artery usually occurs due to a blood clot. Now, how do we know that a patient is having a pain of heart attack or myocardial infarction? It is similar to angina pain. It occurs central side of the chest or left side of the chest, but and it may be crushing heavy, but it is going to be very severe, It's going to be very severe. It is going to last longer than 15 minutes. Okay, and it is not going to be relieved by rest or taking the anti-anginal medications, as I have mentioned previously in angina. Angina pain is relieved by rest or taking anti-anginal medications, but heart attack pain is not relieved by rest or taking anti-anginal medications. So, the symptoms of a heart attack can start slowly and they may persist for hours, days, or weeks before a full blown heart attack occurs. Now we know what are the danger signs of a heart attack. If your patient or anyone is suffering from these symptoms, he or she again needs to be referred to the emergency department. You see, any of these conditions, when the danger signs are there, those are the red flags, which we say. These conditions cannot be treated at home. So do not even think that these conditions can be treated at home. For these conditions to be treated, a patient has to go to the emergency department to a hospital for proper care. All right. Uh, Also remember, as I mentioned, angina, a patient may not experience all of these symptoms. He may not experience such severe chest pain, or he may not experience, the other signs such as sweating or nausea. He may just develop certain symptoms, or he may just say again, घबराहट हो रही है मुझे, I am feeling anxious. That's it. Therefore, it is very important again to send him for an ECG and to further treat accordingly. Now, now that we have identified how what happens when a heart attack takes place and what we need to do when it does happen, again, how what can we do to our lifestyle? What other changes that we can bring to our lifestyle, so as to prevent or reduce our risk of having a heart attack? Again, education. Educate your patient. I'm honestly telling you, we have patients who come to the hospital who have had heart attacks. Okay, who have had heart attacks, who have had their angiographies, angioplasties. Angioplasty, for those of you who may not know, is putting stents in the vessels. And even after that, they do not take the medications regularly. Even after that, they are not taking care of their risk factors. So why we have a responsibility towards our body? God has given us a body. Let's take care of it. When we can, when we have the resources, when we have the doctors, the medicines to take care of it, so we should. It's our responsibility. So again, education is important. Please be aware that you have suffered from this condition and you need to take care of it further. Because if you do not take care of it now after a heart attack, like I mentioned, a portion of your heart muscle has died during a heart attack. This can lead to, if you do not take care of it now, this can lead to heart failure. This can lead to sudden cardiac arrest. Why would you want that? So you need to take care of it first by educating yourself, being aware that this is a condition I have had and I can still take care of it. And again, smoking is a very, I'm reinforcing and repeating it again and again because I'm hoping a few of the, even if you guys take a few of the points home, I have felt I've done something good. So smoking is a huge risk factor. People still smoke after having a heart attack. That is really bad for your heart. So please stop smoking. Again, reduce your alcohol, control your diet, the salt, the fat, the oily food. Have a healthy diet of fruits and vegetables. You can have meat, you can have proteins, but fruits and vegetables, legumes, nuts, grains. Reduce your weight if you're overweight. And if you have had or if you are suffering from diabetes mellitus and hypertension alongside, then please you still need to control those conditions. You need to take medications to keep those under control so as so as not to develop a heart attack again or other risk factors. Okay. Last, I would like to say patients who come and they say that, my father had a heart attack and he passed away from it, or my grandfather had it. So I know I can't do anything to prevent this from happening. And what's the point? The important thing is they say, what's the point? This is going to happen to me either way. Okay. No, this is not going to happen to you either way if you take care of this. And how can you take care of it? By those non drug measures that I've mentioned. If you do all of those, you can reduce your risk. For example, if something was to happen 2 days later, maybe you would prevent it and it's going to happen like an hour later, sorry, a year later or 10 years later. So you can reduce the risk of that happening. No one says that because you have a strong family history that is bound to happen. If you keep a good, healthy lifestyle, you can reduce the risk of having a heart attack. So please, this is very, very important. Also, in all these three conditions, hypertension, angina, and heart attack, you have to remember to keep your cholesterol levels in check. Any of you or whose family members there who are suffering from these conditions, please remember to keep your cholesterol levels checked. Why? Because as I mentioned previously, the narrowing or the blockage of the arteries, you know, it's usually the narrowing occurs due to a fat deposition. So keep your cholesterol levels checked and show it to your physician. And your physician may advise either certain lifestyle changes initially for the first 2 months, or he or she may decide to give you medication, anti-cholesterol medication, so as to lower your cholesterol levels and prevent your chances of having a heart attack or angina. You may be asking, I'm talking about all of this, but I'm not mentioning any medicines. I'm sorry, but I cannot mention any medications here on this forum because all of you are not doctors or related to the health profession. Most of you are, layman in that, in that way. So medications are different for every patient. One, you need to understand. So if some medication suits you, it may not suit your brother. Okay. So it depends on the age, on the factors, histories, what the patient, other conditions that the patient is suffering from. Then only a medication is advised. Okay. So kindly don't do this because a lot of patients do this. They say, I have recently been diagnosed with diabetes mellitus or hypertension a month ago, and my sibling has the same condition, so I've been taking his medication. No, please, you do not do that. Okay, you go to your physician, you discuss with him. Do you need the medication? What doses you need the medication at? All right. So I cannot. Therefore, I cannot tell you any names of any medications, and that's why I'm reinforcing again and again. You need to speak to your physician and discuss the medication plan with you. Because what I am telling you, the non-drug measures, yes, it is going to help you reduce your risk factors, but this is alongside your medications. Both these things are together, they're hand in hand. If I'm telling you the non-drug measures, don't just think that if I do these non-drug measures or lifestyle changes, I can prevent these risk factors from happening, or I will not develop these conditions. No, both of these things go hand in hand. The medications plus the non-drug measures. So please be clear on that side. All right. So lastly, I'll move on to cardiac arrest. Cardiac arrest occurs as the name, most of us can tell by the name. This occurs suddenly and without warning. It is basically triggered by an electrical malfunction in the heart that causes an irregular heartbeat. Okay, so when the heart's pumping action is disturbed, the heart cannot obviously pump blood to the brain, lungs, and the other organs. And a few seconds later, when this happens, a few seconds later, a person may lose consciousness and has no pulse. And that death can occur within minutes if the patient does not get the acute treatment. Okay, so sudden cardiac arrest occurs usually after a heart attack or during recovery of a heart attack. And do remember that when a sudden cardiac arrest occurs, a heart attack is the most common cause. And what happens if any, God forbid, any member of the family or friend just suddenly falls unconscious on the floor? You have to call 1122 immediately. They will have a defibrillator. If you cannot find a pulse of the patient, do tell the services when you call them that I cannot find a pulse. They will bring a defibrillator. It's basically a machine which gives electric shocks to the heart. You may have seen it on TV shows or on movies. So while 1122 is coming, if any of you know CPR, which is cardiopulmonary resuscitation, please start immediately. As soon as the patient falls down, you do not see any signs of breathing, you do not feel the pulse, please start CPR. It is not only doctors, paramedics, or nurses who know CPR techniques nowadays. Layman people who are interested, take up this technique, learn it through online courses so that they may help their family members. And I think it's a good course to take, and it helps you in the long run. So this is all about cardiac arrest. I have spoken to you about the common cardiac conditions, as I mentioned initially, how to identify the danger signs. So we spoke about hypertension, angina, myocardial infarction, this is a heart attack, cardiac arrest. What are the danger signs? How do we know that this is what is happening to the patient or this is the condition that is happening? And what can we do to prevent or help a family member or anyone from developing these conditions or reducing the risk of developing these conditions and reducing the risk of the complications of these conditions. So we've spoken about this. Again, I would reinforce medicines are very important alongside the non-drug measures. Um, so I'm done here. Thank you from my side for listening so patiently. If there are any question answers uh, anyone is wanting to ask, please feel free to ask, and I will answer to the best of my ability. So please feel free. But I think we can take a break initially while you guys sort out your questions. So let's take a break.
ये तेजियां ये फुर्तियां ये इस उम्र की करनियां यूं तो मैं 40 हूँ अंदर से अब भी 20 हूँ ऊंची सी उड़ान हूँ अभी तो मैं जवान हूँ अभी तो मैं जवान हूँ कैल्शियम हर रोज है काम की ये डोज है हड्डियों में जान है तभी तो दिल जवान है कहने को अम्मी जान हूँ अभी तो मैं जवान हूँ अभी तो मैं जवान हूँ
कैल्शियम और विटामिन डी के इस्तेमाल से अब हर औरत बोलेगी
There are 1,000 ways I can.
Public service message on calcium awareness.
Okay, so welcome back to Health Hour. I'm going to be looking up at these questions if there are any. There is a question that I'm going to, or there's a case that I'm going to discuss with you. I was given a little bit initially. Uh, let's see. So the case was this is a 17-year-old baby. This is someone who has asked me a 17-day-old baby. Uh, since I don't know the details, the patient's mother has not spoken to me herself. I have only the patient's reports, which show that patient has had a echocardiography done, and it is showing VST. Um, as I said, I've not spoken to the mother as yet. I don't know what the patient or the child was going through. So VSD is basically, if the mother is listening, VSD is basically ventricular septal defect. It is a congenital heart disease, as in it occurs by birth. Basically, it means in layman language, you may have heard hole in the heart. Okay, so this occurs by birth. Uh, the child may have symptoms. I don't know if your child had any symptoms, maybe fast breathing, fast heart rate, paleness of the skin, or fluid discoloration of the skin. This is basically when the blood flow within the four chambers of the heart is not flowing accurately in the right directions. So for the relative who is listening, uh, basically this patient is seen by a pediatric cardiologist. I'm a family physician. I can only guide you accordingly. So I would suggest please take your baby to a pediatric cardiologist. Um, these conditions require surgery, but not necessarily. The doctor may just say that I need to observe the symptoms. And if surgery is needed, it occurs usually in the first year of life. So I hope I'm able to answer your query regarding this. And if there's anything else, you can contact me through this organization. So I have these questions from Mustabeen Butt. He has asked, can exercise and diet help? Uh, no longer need cholesterol and blood pressure medications. So, if I have understood the question correctly, are you asking um, if exercise and diet can help? Do we no longer need cholesterol and blood pressure medication? No. Please. I have reinforced this in my presentation earlier. These are the non-drug measures. Yes, that exercise and diet help. Okay, but they do help in reducing the risk factors. But you need to keep on taking your medications if you have been prescribed, and if you have not been prescribed as yet those medications, then please speak to your physician, because your medications will need to be started. You need to recheck your cholesterol levels. Speak to your physician. If you're suffering from hypertension or angina pain, then your medications need to be started, right? But exercise and diet are just the supporting factors. But this is not the cure or the health or the complete. Like I said, they're both hand in hand. The medication plus the non-drug measures. If you do both of them together, then only you will get the right results. All right. And just before this show started, I had someone asking me a query about their relative, that he had a blood pressure reading of, let me tell you here, he had a blood pressure reading of 200 by 100 yesterday. But today his blood pressure is normal, but he is complaining of feeling uncomfortable in his stomach area. So, if any of you remember, this is what I discussed initially when talking about angina and heart attack, that a patient may just come with the complaint of be feeling uncomfortable in the area of the heart, of the stomach. So, as I've advised that patient, the patient still needs to go to the emergency department because he has history of high blood pressure, of uncontrolled high blood pressure, and he's feeling this uncomfortable sensation in his stomach area. So the patient needs to go to the emergency, get his ECG done. So this is obviously important again. If there are any more questions that anyone would like to discuss. I am not receiving any more questions. Should we take a break for a second in case anyone wants to think up of more questions? So we'll take a break again.
ये तेजियां ये फुर्तियां ये इस उम्र की करनियां यूं तो मैं 40 हूँ अंदर से अब भी 20 हूँ ऊंची सी उड़ान हूँ अभी तो मैं जवान हूँ अभी तो मैं जवान हूँ कैल्शियम हर रोज है काम की ये डोज है हड्डियों में जान है तभी तो दिल जवान है कहने को अम्मी जान हूँ अभी तो मैं जवान हूँ अभी तो मैं जवान हूँ
कैल्शियम और विटामिन डी के इस्तेमाल से अब हर औरत बोलेगी
There are 1,000 ways I can.
A public service message on calcium awareness.
Okay, welcome back to Health Hour. I think there's supposed to be another question coming up, I've heard. So we'll wait a second. Okay, there was a question by Chaudhary Akib Zia. Any remedy or initial treatment of high blood pressure? So, remedy or initial treatment of high blood pressure. Okay. So, once if a patient has been diagnosed with high blood pressure, let me just, I think this was not mentioned previously. You do not diagnose a patient with high blood pressure on the first reading. If a patient comes with high blood pressure on the first reading, you need to send the patient home for a 5-day blood pressure recording at home. Because normally, when patients come to the clinic or the hospital, they tend to be a bit stressed. and at that moment their blood pressure does go up, and which in medical terms we call as white coat hypertension. So if a patient has high blood pressure, on the first reading in the clinic, we tell him or her to take regular readings for 5 days, 5 to 7 days, and bring us that chart. And if the patient, and if in those readings we see that he has had continuous high blood pressure for more than 3 days in a row, then we diagnose the patient as hypertension, and then we start him on treatment. Treatment is started basically on how high the blood pressure values are, and what is the age of the patient, and if he has comorbidities. So as I mentioned, I cannot tell you the medications here on this forum, uh, because it is varies from patient to patient. But yes, the remedies that I've mentioned for hypertension, I can reinforce again. Education of the patient, compliance of his medications, dietary changes, which is reducing his salt intake, fatty, fried, oily foods, reduce caffeine intake, reduce his alcohol intake, stop smoking completely, kindly reduce his stress levels, control his sugar levels if they are uncontrolled. So if he does all of these lifestyle changes, he or she brings to his life, he can keep a control on his blood pressure, but with the help of a medication, if the doctor finds it feasible to prescribe at that point. If you have a certain example in mind, you can always share through this organization with me, and I will be more than happy to answer any of your queries, if any of you have later on also. um, so are there any more questions? Okay, there seems to be no more questions for now. Again, I will say if any of you have any queries related to cardiac issues of any sort, or any relatives suffering from any of these issues like hypertension or angina pain, please you can contact me through this organization, and I will help you as best as I can. So since there are no more question answers right now, questions here, I would like to end this session today. It has been a wonderful opportunity for me. I'm glad to be here to create certain awareness about these important cardiac issues. I'm thankful to Caregiver Alliance for contacting me and inviting me to present on this session about this important topic. Um, so before leaving, thank you to all the viewers, one, for listening to me so patiently, and for the ones who have asked questions. Before leaving, a very, very important message for all of you regarding the situation we're going through nowadays regarding COVID-19. I mentioned in the initial part of my presentation that we all have a responsibility as human beings, as citizens of this country. We have a responsibility to not only ourselves, but our family members, the people of our community, the people of our country. So please, wearing a mask is of paramount importance. We have patients coming in who say, okay, there's no such thing as corona. It's a myth, it's a conspiracy, and all of that. Please, please, if you know people who are saying things like that, educate them, create awareness. There are people suffering from this dreadful disease, there are people dying from this disease. Kindly educate people so the cases are reduced. So educate them, educate yourselves about this virus, how it is spread. Wear a mask, please. A 6 feet distance is important. I'm just going to take a minute to explain to you why, because this virus is spread through droplets. When we speak, we sometimes have droplets coming out of our mouth. When we cough, we sneeze, we have droplets coming out of our mouth. So if you're, standing further more than 6 feet away from someone, you are at a safe distance. But if you're within 6 feet and the person is not wearing a mask and he's, spreading droplets like this by speaking or coughing or sneezing, then you have a chance of catching this virus. So please make sure that everyone around you is wearing a mask. One, everyone around you is keeping a safe distance. You need to keep a safe distance. If you keep a safe distance, the people around you will follow. Wash your hands regularly. If you go out for grocery shopping for some essential work, if you touch any surface, please use a sanitizer immediately or wash your hands immediately. So please stay safe, keep yourself safe, stay healthy, and I wish you all the best and good luck with managing and handling, Corona situation in these days. And take care of yourselves. And thank you for having me here. And goodbye. Have a good night. Bye bye.